Cars 108, 80s, 90s, and now. How you doing this morning with a fantastic Wednesday? A little gray outside, but it's a nice kind of gray. It smells fresh.
It smells like rain. Yeah, I like it.
My name is Pat. That's AJ.
We're watching some wild turkeys outside our front window here. They're like hanging out by the antenna out there. It's going to be partly cloudy today, isolated showers, highs near 53.
All right, welcoming in the studio right now, her name is Suzanne. Suzanne will give you privacy and not bust out your full name unless you want it. But Suzanne, you work for Genesee County, and more specifically, you work for the Genesee County Health Department.
That's correct.
And you are here to talk to us all about a survey that is happening right now. Now, it's going to be a big year for surveys. If folks don't know, we have a census that's going to happen this year. Right. Please, good Lord Almighty, answer the door for the census people. You have no idea how much that's a long-lasting effect.
Yeah.
So, to maybe kind of warm you up for that, let's have you do this first. There is a survey happening right here in Genesee County. It happens every 2 years. And it's time, once again, for you to participate. And when you do, there's a carrot on the stick. And that's what Suzanne's here to talk about. First off, let's lead with the carrot. People do get a little gift card for participating.
They get a $5 gift card for completing the survey.
Yeah.
And the survey is done every other year. It asks questions about quality of life and health for everyone that's living in Genesee County. And we're asking everyone 18 years and older to take the survey, fill out the questions. The information that we get helps us with planning.
Okay.
So it helps us with planning for health programs. It helps us evaluate programs. It gives us an idea of where the gaps in service are.
Sure.
So it's incredibly helpful in us making sure that all of Genesee County residents are healthy.
Now,
I like what you said about it before we went on the air here. You basically said, in a nutshell, it's to find out how stressed out people are.
Well,
in general.
Well, but we get like a lot of stats, like the stats about happiest places to live and all this stuff. Where do you think that information comes from? No one makes it up. This is how we get it. Now, people, unlike the census, where people are going to knock on your door, which these days makes people lose their minds.
Nobody answers their door anymore.
Let alone if your phone rings and the number's not stored, you
freak out. Don't answer.
Someone knocks on your door and you think it's like an invasion. People don't even have to open the door. They can just go online.
They can go online and take the survey at www.gchd.us/speak and take the survey. We can also work with community organizations that may have members who want to take the hard copy version of the survey.
Yeah, sure.
So we'll come to them. We'll actually bring hard copy versions of the survey.
Okay.
We'll read through it so that it'll help people get the answers on the sheet and
so,
take it away with them.
Even folks who aren't you have the elderly, you just have some people that just don't do computers, they can still participate in this as well. Now, obviously.
When you said, you were talking about services.
Yeah.
What kind of services do you guys provide? And, what are you looking for information on with this survey?
Yeah.
So the survey asks questions about health and quality of life. So we'll ask about neighborhood conditions. We'll ask about financial health. We'll ask about stress levels and mental health. We'll ask about consumption of fruits and vegetables and how much time you exercise. And we do this and we can break it down geographically.
Okay.
So we can actually map the responses to see, okay, is there a need for an exercise program in the south side of town?
Gotcha.
Okay.
And that gives us a better idea of where people need help and where to put the resources.
Well, and also just long-term planning. Again, this is how you say, well, these towns, these parts of the country, they went from earning this amount of money to this, to that, to how do we make things better? Are cities coming back? Are they declining?
Yeah, exactly.
These are things that we figure out. Now, we're here right now with Suzanne. She's here from the Genesee County Health Department. Coming back, give us 3 minutes, and yes, we will talk about it. The Flint water crisis on the 4-year anniversary of the switch over to the Flint River and how that's affecting a lot of this survey, okay? It's Cars 108 at 8:21. Cars 108, 80s, 90s, and now we're online, WCRZ.com. If you want to listen, I'm Pat, that's AJ.
It's 8:24, going to be partly cloudy today. Some isolated showers possible, highs near 53.
All right, we're still in studio here with Susan. Susan, you are part of the Genesee County Health Department. You guys are in the midst of the Speak to Your Health community survey. This is an online survey that you guys take every 2 years, and this is basically to help identify, monitor, understand the health and quality of life here in Genesee County. These are the things that we end up showing off to other people, you know, like when businesses think about where they want to move, and maybe when people are looking for new places to move to, you know, we want us to be a destination. Now, obviously, how can we get through this without asking people how the Flint water crisis ties into this? We are today's the 4-year anniversary of the switchover. All right, so this is the official day when everyone, you know, we all saw the picture and we clinked the glasses, and here we are now, 4 years later. No, it is not fixed. Yes, there is still lead in the water.
It's another water drive tomorrow we're part of.
So how is this survey going to tie into all that?
So in the last iteration of the survey, which was in 2015, we did ask questions about water and how you used water, if you used bottled water, if you used filters. We asked a lot of questions about water quality.
And was that now 2 years ago? Were we still?
We were before we were actually declared a water crisis.
So that was
because we were worried about what was being discussed in our community and the quality of water, and so we asked questions and we got a lot of great results. That information serving as a baseline now as we move forward, is we're also asking more questions on this survey.
See, I was going to say, this one you guys are going to ask probably direct questions, because now you can say, were you directly involved?
We're asking some of the same questions that we asked before, so that we can get an idea of what the trend looks like.
Sure.
But also, when we did some mapping, again, we talked about having the capacity to do mapping of the responses. We did find where the water quality was self-declared as being poor were actually sites where it was poor. So the information that we have actually validates what people are concerned about, and that's part of why we do this. And also recognizing that we write grants with this information and bring money into the community to help improve the quality of life and the health of our community.
So this survey, it happens every 2 years. So it's not like we're asking people to take part in it, you know, every 6 months or something.
Well, we were just talking off the air about how important this is going to be in the long term, because you're not going to see the effects of, you know, the lead in the water for a long time. And to have these surveys every couple of years is going to be really helpful. I mean, we were just saying instant gratification. People want to know what's going on right here, right now. But this survey will help for years to come.
Okay.
That's true. And we also are available to come and talk to community groups and bring the survey information back into the community. That's important to us as well. When people take the survey, we want them to know what the results are.
All right, now the website is gchd.us/speak, but we're also going to get the links up at WCRZ.com.
Yeah, we'll have all the information.
All of our social. But not only is this something that we're asking you to do, but the county is going to actually help you out for your time. And by the way, how much time does it take to really take this survey?
20 to 30 minutes, depending upon how many questions you are answering, because there are some skip patterns in the survey.
If you do it in 20 minutes, that means technically it breaks down to about $30 an hour. See? So they're actually making out pretty well. Right? If people cannot get on the website, you will come to them?
Yes, they can call the health department, ask for Suzanne. We can actually set up appointments where we'll bring the hard copy versions of the survey to them.
All right, when would you like to have this all done by? When's your deadline?
We're hoping to get it done this summer, but we want to make sure that we have a representative sample. That means that we hear from everyone from every corner of Genesee County.
So your voice matters to Genesee County Health Department. We're going to get all these links up at WCRZ.com for folks to take the Speak to Your Health community survey. Like I said, let's use this as a warm-up for the census that's going to be happening this year.
Exactly.
Let's not be afraid to give our information. We're all in this together, and that's
you probably get more information on Facebook on a daily basis than you would in this survey.
This survey does not ask you for your name.
See?
What? So, you don't sell your information?
We don't sell information. We do look for the zip code so that we can get some more detailed information. But we don't take names, and we do give a $5 gift card when you've completed it.
Well, thank you so much, Suzanne, from the Genesee County Health Department for coming in, okay?
Thank you so much.
All right, there you go. We'll get the links up, WCRZ.com. Speak to Your Health Community Survey. Take it today. It's Cars 108.